Good day, everybody. This is Chris of the Ancient Scholar, and in this particular vignette, I'm going to be talking about the knee joint. This is one of the most important joints in the body. It's very complex, very prone to injuries, a lot of stuff going on there, so it is certainly something that you're going to come up against in a lab. So this is an example of a synovial joint where you have movement. This particular joint only allows movement in a certain way. Basically, it only allows for flexion and extension, so we'd call that a uniaxial joint, very similar to the elbow. So when we look at the major structures of the joint, the first thing that you need to do is you need to orient yourselves to the major osseous structures. So here, if I pull the patellar ligament away, the large bone up here, of course, is the femur. Okay, and then the femur articulates with the tibia here and then the fibula here on the side. Now, it's very important to orient ourselves to the medial aspect of the joint, and the medial aspect is always going to be along the tibia here, and then lateral will be along the fibula there. Okay, so medial, lateral, and that'll be important to understand that differentiation, because when it comes to naming the structures, there is a medial, a lateral aspect of the structure, and there's a fairly significant amount of symmetry to the knee as well. Okay, so let's just go ahead and talk about the articulating structures here. So here I have the end of the femur, and I have the hyaline cartilage, or the condyles, and I have both a medial and a lateral condyle. And as you might guess, the lateral condyle is going to be this here, which articulates near the fibula, and then the medial condyle will be this area here, which articulates with the tibia. Okay. You also have meniscus, and meniscus is a type of a special type of cartilage that gives additional stability to this joint and to the joint capsule. And you also have a medial and a lateral meniscus as well. Okay, again, medial being toward the tibia, lateral being toward the fibula. And then, of course, these condyles will be covered in articular cartilage, both on the femur and then, of course, on the tibia as well. The fibula does not actually articulate with the joint capsule proper. The fibula articulates with the tibia, so it's really the femur articulating with the tibia there. Okay, so we have two large ligaments on either side of the joint capsule, and I've got this ligament right here, which is toward the tibia. So we would call this what? Or toward the tibia. We would call this the medial collateral ligament, or the MCL. Okay, and then I have a large ligament over here that attaches from the femur down to the fibula here. Okay, and again, fibula being lateral, so this would be the lateral collateral ligament, or the LCL. So I've got the MCL and the LCL. These are very important ligaments in that what they do is they resist lateral stresses. Okay, so the knee is supposed to articulate like this, okay, kind of like a basic hinge, okay, and so this prevents lateral instability of that joint. Okay. Okay, so that's the first of the two major. Of course, I have the major ligament on the anterior surface here, which is the patellar ligament, which connects up on the femur up higher, and then connects down here onto the tibial tuberosity. Okay. If we peel that away, I also have two ligaments within the joint capsule itself. I have a ligament. Okay, if I spin this around, you see this ligament starts right here, and then it kind of crosses underneath this ligament here. So it crosses, and then it comes up to the front here. Okay, you can see it moving up more toward the anterior aspect here. Okay, and because it moves from a posterior to an anterior direction, we call that the ACL, or the anterior cruciate ligament. And of course, this is a common injury, both to the meniscus and to the ACL, the anterior cruciate ligament, and that really helps to prevent hyperflexion of the knee. So it prevents our knee from flexing too much in one direction. And because hyperflexion isn't something you often run into when you're using your knee, it is not uncommon for people to have ruptures or tears of their ACL ligament, their anterior cruciate ligament, and still have a fair amount of functionality with their knee or stability within the knee joint, because they're not running into these situations where they're worried about hyperextension. Did I say hyperflexion? Or, anyway, the ACL prevents hyperextension. Okay, hyperextension. I believe I said flexion. Sorry about that. Yeah, so the ACL prevents hyperextension. So extending the knee. So if you're not doing an activity where you're risking overextending your knee, you may have a reasonable bout of stability. But again, if you end up overextending that, or you're running, or you're cycling, or doing some sort of sport where you're extending that knee out, martial arts, for example, kicking or something like that, then an ACL injury can certainly be very problematic and cause instability. Now, the other ligament, okay, so you have the anterior cruciate ligament, and then you also have something called the PCL, or the posterior cruciate ligament, which remains posterior. So you can see it begins here on the tibia and then attaches to the posterior aspect of the femur here. Okay. Specifically, it attaches to the posterior aspect of the medial condyle. Okay. This is called the PCL, or the posterior cruciate ligament, and the posterior cruciate ligament really prevents posterior displacement of the tibia. So you have the tibia here in the femur, and it prevents that tibia from being displaced or being pushed to the posterior aspect. So damage to the PCL can make that knee joint, the knee joint, rather unstable regarding posterior, moving too far posteriorly and putting stress and stability on that ligament, or on the joint as a whole. Okay, so just to recap the major anatomical structures, we have the patellar ligament. The patella, of course, is a sesamoid bone, so it's completely encapsulated in that tissue. You've got your femur, you've got your tibia, you've got your fibula. Okay, you have got your lateral collateral ligament, you've got your medial collateral ligament. Okay, you then have your ACL, your anterior cruciate ligament, and then back there you can see the PCL, or the posterior cruciate ligament. Okay, you've got your meniscus down here, provides extra cushioning and stability to the joint capsule. That you then have your condyles. You've got your lateral condyle here, your medial condyle here, and of course this is covered in articular cartilage. Alrighty, guys, so that's your introduction to the knee, very important joint. All right, as always, thanks for hanging in there.